Hey, good evening, ladies. Happy Wednesday. Welcome to Wellness Wednesday. So I wanted to, but while everybody's jumping on, it's like there's several ladies jumping on. So let's just give them a chance to get on for tonight's topic. But I have been reflecting on some information I gave during the masterclass, and the topic about thyroid conditions, different thyroid conditions came up, and some questions were asked. And so we're going to be covering some of those, just because I want to provide a little, hopefully give a little more clarity to some of these other thyroid conditions. So let's see, we're several more joining us, so that's great. Hope everybody's having a good Wednesday and a good week. It's been nice here in Boise. I don't know where everybody else is, but yeah, it's getting warmer, which probably helps with your cold intolerance, right? No, and as we get talking about these thyroid conditions, it can be super frustrating when you feel like something is wrong with your thyroid, and you go in for an evaluation, and you're being told, you're being diagnosed with different things and not necessarily correctly, and you may not know that, or you may question it, which is okay, but there's several reasons why some of these conditions are misdiagnosed. Okay, great. I think I'm going to just get started with what I wanted to get into tonight. So the first other thyroid condition, we talked a lot about hypothyroidism, but hyperthyroidism is a question, it has come up in several questions. And hyperthyroidism is when either you are producing too much thyroid hormone, or it is too active, hyperactive in your cells, and it can cause symptoms like actually being too hot, being shaky and kind of amped up. It can be, you can feel sweaty, easily sweat. You easily sweat with minimal exertion, or even just with anxiety, feeling just really revved up. You'll probably be losing weight more quickly than you thought. Maybe you were trying, but maybe you're really losing a lot. Or maybe you weren't trying and you're losing a lot too quickly. And certainly this can cause a lot of inattention, and so these are some of the common symptoms that you might get with hyperthyroidism. Certainly, if you're not losing weight. Oh, I almost forgot. Really, really important. Heart racing can be a symptom of hyperthyroidism. It can also be a symptom of hypothyroidism, but we're going to talk specifically about maybe why it can be more, or why in this case we want to think hyper. Okay, so one of the reasons why this gets misdiagnosed as Graves is that simply they're not testing the antibodies. All right, there's a very specific antibody that shows up in autoimmune hyperthyroidism, and this is generally why most people have hyper or higher functioning thyroid, too much function with their thyroid. And so we're talking about most often Graves' disease, which again, it's often misdiagnosed, but that's what's most commonly diagnosed is Graves' disease, even though the antibodies were not checked. And so, well, what do you do? What do you actually do to diagnose it? The other reason can be cancer, and we're going to get to thyroid cancer in just a moment. Okay, so again, there's several reasons why this gets misdiagnosed. You got to get the right testing. So TSH receptor antibody testing is what's required to diagnose Graves' disease. And you've probably heard of the common signs of this. Again, losing a lot of weight, someone who's very thin, someone whose eyes bulge out of their eye sockets, called exophthalmos. And certainly you could get a swelling or a goiter type appearance of the thyroid. And so these are, this again can be misdiagnosed. I did a presentation on Hashimoto's several weeks ago and mentioned how there can be hyperthyroid phases in Hashimoto's as well. Because when you have thyroglobulin antibodies, anti-thyroglobulin antibodies, when you have those and the immune system gets triggered and attacks and destroys the thyroglobulin that's tagged with these antibodies, it's like water balloons being popped. So these thyroglobulin, thyroid hormone carriers or packages get popped, destroyed, right? And they spill out their hormone. And so all that excess thyroid hormone, causes a reduction in TSH. And it can cause those symptoms if you're at a threshold where you were doing okay, and then you go hyper in symptoms. All right. This is a very common way Hashimoto's starts, how it gets going right after the birth of a child, even after, during or after adolescence. This is the most common time for that to start. I've even seen it happen in young children. Okay. I've seen children born with this, or personally haven't seen, I've heard of children born with this. I've seen children and treated children at very, the youngest one I treated was 5 years old with full-blown Hashimoto's. Okay. So this gets misdiagnosed as Graves because, again, the wrong antibodies were checked. The interesting thing is they might treat you with a medicine to reduce that response called methimazole. And then as that goes away, that immune system rampage, as that lessens, and you're still taking this methimazole to block that response, that hyperthyroid response, now it causes you to really swing hypothyroid. And then you're getting the hypothyroid symptoms back, and you gain more weight and less energy and all the symptoms that we know so well. Okay, so I hope that clarifies a little bit why hyperthyroidism can be misdiagnosed. And certainly if they miss a cancer, that's not good. But as I talk about that in a minute, I think it'll make sense that it's usually not as serious, but we do need to find out what's going on. Okay, so that's hyperthyroidism. And this can go up and down with Hashimoto's and with Graves. And the thing to do always is look for the root causes. Find the triggers for the immune system so that the immune system stops attacking and destroying the thyroid tissue, which it will do with Graves' disease also. As you rev up, as the TSH receptors are stimulated, in the thyroid, you make more and more thyroid, and that's typically what the immune system does when these these antibodies are present. Okay. So athyroidism, meaning when you do not have a thyroid gland after thyroid surgery, thyroidectomy, or if you just have a thyroid ablation, you still have a thyroid gland, but its function is usually severely depressed because of that radioactive iodine treatment. Okay, so what happens in this case? How do you monitor it? What are some issues that I have seen with not having a thyroid and still being on thyroid hormone, and then going to your doctor and they're checking a TSH still? Thyroid stimulating hormone. Okay, so you don't have a thyroid gland. Try to follow me on this. You don't have a thyroid gland, and yet they're still checking thyroid stimulating hormone to assess thyroid function in your body. That's a brain test. Thyroid stimulating hormone is from the brain, the pituitary gland. And when you don't have a thyroid gland, it has nothing to stimulate. It doesn't have a landing place. The only thing that happens is that when you're given a certain amount or an amount of thyroid replacement hormone, the TSH drops. But if it drops too much, is that really a sign of hyperthyroidism? So again, misdiagnosis happens all the time. And as soon as that TSH drops, you haven't changed in your symptoms. You're still overweight. You're still tired. You still have brain fog. You still have indigestion, constipation, but you still have neuropathy. You still have all the symptoms. And now your doctor wants to lower the thyroid hormone replacement just because the TSH is low. It's already suppressed. It's gone. There's no thyroid gland to stimulate, and you're not going to produce too much. And they're lowering your thyroid hormone. It just doesn't make sense. So this is in most cases of athyroidism or lacking a thyroid gland, a TSH is practically worthless. You've got to get all the other tests. So I hope that makes sense. Okay. Thyroid cancer. Thyroid cancer can cause hyperthyroidism, right? An overproduction of hormone because you've got maybe a papillary or a follicular cancer that's formed, and you're going to make too much hormone. These are the two least dangerous of the 4 types of thyroid cancer. The papillary can spread to the lymph nodes. It usually does so pretty slowly, but it can spread to lymph nodes. Follicular, it is the slowest growing, and it really is unlikely to spread to lymph nodes and other areas. So these are certainly the best types of thyroid cancer to get, and there is a 98 to 99% 20-year survival rate if nothing's done with these cancers. The only issue that you might come into is if you have symptoms that this is affecting. So if you have a cough without a cold, a constant persistent cough, changing of your voice as it can press on the voice box, you can have trouble swallowing because it's pressing on your esophagus, and and trouble breathing. So that, of course, would be not good. So good reason to maybe consider surgery for these types of symptoms. Okay, medullary cancer and anaplastic thyroid cancers. Anaplastic is the most aggressive type. It grows the fastest. It only occurs in about 1 to 2%, so it's very rare of folks with thyroid cancer. It occurs in individuals mostly in individuals over 60 years old, and it is more common in women than in men. But it's, again, rarely fatal. Most of the time, again, very, very high rates of success with cancer, thyroid cancer treatments. And there are some new drugs. There's an immunoglobulin that tends to do very well, or it's shown to be really effective, fairly effective. I'm not the expert on thyroid cancer, but what I've seen is it's fairly effective. It's a new drug. And so they're certainly in the middle of using it more, trying it more with thyroid cancer patients. So there's not usually a huge rush because to treat or to surgically remove a thyroid gland that has cancer, just because most of these are papillary and follicular, and they don't grow as quickly, and they have such a high rate of survival. So I would tell you that in functional medicine, what I have learned is that cancer is a metabolic disease. It has origins in inflammation, toxicity, infections. Okay, so what happens when we find and treat those root causes? What do you think is possible with that? I very much believe it is possible that you can see a reduction, a slowing down in some of these types of cancers. I am not going to advocate treating them necessarily this way because I don't know that I can't prove that is effective. So please hear my words. I'm not advocating for that treatment. I'm saying if it's like any other disease process, if you can fix the root causes, it's worth asking the question, can the body heal itself? Okay. So I'm going to leave that there and go on to just finish up. And maybe we'll actually get into some questions. We'll look at the time. We may be able to do some questions. So you can have, I got into a discussion with a patient a week or so ago who was missing a thyroid. And okay, I'm told that there are no questions coming up so far, but if you do have a question, we can, doesn't have to be about this topic. It could be about something else. I can take a few, but let's get through. So I was discussing this with a potential patient who has no thyroid. And it became clear that more testing was needed because she's got hypothyroid symptoms. She is on thyroid replacement and it's not really working. She's wondering why she has the fatigue and the brain fog and the dry skin and losing her hair when she's taking thyroid medication like she's supposed to, and her numbers, she said her labs all look normal, and she's still suffering. So we went through this explanation, and made sense to go ahead and get further testing, like I went over in the masterclass. Comprehensive testing to arrive at a comprehensive diagnosis, and so that's where we're at. Now, I also had a discussion with a patient recently that wanted my opinion about getting her thyroid removed due to cancer. And it's a tough decision, because if certainly it might make sense if the whole thyroid is involved with the cancer, with depending on what's going on, if there's Graves' disease. So autoimmunity, Graves' or Hashimoto's can lead to cancer. Okay. And so is it possible to, treat those root causes and bring those into remission, and like I said, slow down that destruction? Yes, absolutely. In both cases, whether it's Graves' causing hyperthyroidism, or whether it's Hashimoto's causing both, or alternating hyper and hypothyroidism. And that's just what we've got to find out. We've got to find out what those triggers are with the right testing. So anyway, this was an interesting discussion, and it just is a very individual decision. She wanted to save her thyroid her thyroid gland as much as possible. So we discussed that, and I'm not going to go through and a whole lot more details about that. Only to say that it is a very individualized discussion, and you deserve individual attention on that. So, okay. So let's see. Do I have any questions? And if we don't, then yes, what is comprehensive testing? Comprehensive testing means we are getting all of those thyroid markers, all of those that make up a full thyroid panel. 12 markers, there are 12 markers, and testing for these, as well as all of the other tests that we need to get, including, let's just go through a certainly a complete blood count, a comprehensive metabolic panel, several other liver enzymes that are not usually in that panel that help me to know how your liver is functioning, because an unhealthy liver equals an unhealthy thyroid function. Oh, and by testing all those thyroid tests and looking at some others, we can identify over 22 different diagnostic patterns when it comes to thyroid disease, hypothyroidism. That's crazy. There are a lot. We're going to get insulin and an A1C. We're going to get iron studies and ferritin. We're going to get vitamin D. We're going to get fibrinogen and CRP tests. We're going to get homocysteine and uric acid tests. We're going to get an HLA-DRDQ genetic test for your immune susceptibilities to see if you are susceptible to biotoxins, which are huge causes of autoimmunity, including autoimmune thyroid conditions and thyroid cancers. We're going to test for, we're going to do a urinalysis to make sure your kidneys, aside from the blood tests, are doing well. Let's make sure there's no infection. We are going to get a lipid panel with all the cholesterol particles that we need to know about, and the ratios. yeah, we're going to get a lot. Plus saliva testing to see what your adrenal glands are up to, because unhealthy thyroid function equals unhealthy adrenal function. And you need your adrenals to function to help you handle stress. You need your adrenals to function to help you with hormone production in postmenopause. You need adrenal function for fluid and electrolyte balancing, just all of it. There's so many hormones that your adrenal glands produce. And then we test food sensitivities, right? Immune triggers. And certainly they cause inflammation and leaky gut. So we just see how all of this ties together, and then we put these test results together, and I give you a comprehensive diagnosis. So, okay, let's see what other questions. Can you have more than one underlying issue? Jolene, that's a great question. Absolutely. Abso-freaking-lutely. Usually there are 4, 5, 6, at least underlying issues and imbalances. When I get these tests and go through them with you, now I've seen a lot of tests, but most of the time, patients, as we go through this, are shocked. Most of the time. Yeah. Let's see. Guys are kind of quiet. Let's see. I think. Oh, interesting. Okay. I'm not going to say your name, but you said, I have PCOS, so everything gets blamed on this, and they say, go home and lose weight. Gosh, that's frustrating. Terribly frustrating. Polycystic ovarian syndrome, caused by a hormone imbalance. But what causes that imbalance, where you tend more toward androgen production, or versus estrogen production? It's insulin resistance. And do you remember when I talked about this, how insulin resistance, yes, it can be related to diet. It most often is. And it can be related to hypothyroidism. And yes, it's found during adolescence a lot of times. But when can insulin resistance start? It can start in childhood. It can start in toddlerhood, when, especially if you were a baby that was born to a gestationally diabetic mom. Yeah, it often starts with low thyroid and it's insulin resistance. They don't have a pill for insulin resistance. So this is why they fumble around. And if they do pay attention to you and try, and I'm happy that they might try, but they're just throwing darts and trying to balance your hormones, and that rarely works. I mean, sometimes it works enough to help you overcome maybe some infertility. But the underlying issue is still there, right? Hopefully that answered your question. Yeah, glad that's a good question. Okay. Oh, let's see. I gained 140 pounds really fast with my thyroid doctor said mine is a thyroid, you lose weight. And again, let me see, hold on, let me try to get, okay, so yeah, I'm trying to see that. Okay, so oftentimes, and I understand how frustrating it is to gain weight when the doctor treats your thyroid, but oftentimes it's not just a lack of thyroid hormone that's the problem. It's inflammation, which doesn't allow a thyroid replacement hormone to work. So you might have been given thyroid, but thyroid replacement, but it may not have been something your body liked. It was, a lot of these are made with really bad ingredients that you might be sensitive to. So, yeah, it's super frustrating when they're not taking everything into account. All right, another question. Does the comprehensive diagnosis include a plan of action? Absolutely. I spend time sit down with you and review all of the tests and give you a comprehensive diagnosis and a plan of action to including a customized plan. I outline a framework of treatment for you in which you will receive customized care if it makes sense. As we talk about everything, then at that point, we decide if it makes sense. I decide if I take you as a patient and what that means. So that's a great question. I have another question that how does chemotherapy affect, well, I got to get it right. Hold on. Well, how does chemotherapy affect the thyroid? So because chemotherapy acts on the cancer cells and healthy cells, it can shut down healthy cells. So it's a double-edged sword, right? And we have to support those good cells in their metabolism to function. Metabolism means cell function. It doesn't mean, just losing weight or whatever. Metabolism is cell function. And so you have to support cellular function while you're on chemotherapy. And because it absolutely does affect it. Okay. Can mercury poisoning cause, I believe that says Hashimoto's. Mercury poisoning can definitely affect the thyroid gland, thyroid tissue, and cause it to cause you to develop Hashimoto's. Absolutely. Okay. How do you lose weight when your body wants to hold on to the weight? I also have fibromyalgia, so it's hard to exercise. I hurt all the time. Yeah. When you are inflamed, when your body is stressed from physical, chemical, emotional stress, all of those are stress. Toxins are included in that. Foods, infections. Look, when you're overstressed and then you start to exercise and you have this fibromyalgia pain, it's even more stressful on your body, and you're not going to lose weight. Your stress breeds cortisol, it breeds inflammation, and when you're inflamed, it's going to be very difficult for your body to release fat, and so you can drop weight. That's it. You have to find those stressors. So you have to do the tests. You have to find out what your causes are, what your stressors are. So I say those interchangeably: stressors, causes, irritants, immune triggers, these all kind of mean the same thing, right? They all cause inflammation and they will prevent you from being healthy. They'll prevent you from losing weight. And I don't like that term. Remember, prevent you from letting fat go, dropping weight, whatever. And then you'll hurt more. Okay. I think that's about it. Congratulations, Colleen. That's amazing. I think I answered about PCOS. Let me just double check that. Yeah, I mean, I explained that. Let me, yeah, so if your daughter has it and if you have it, we really have to test. It's like, I wouldn't want to guess. We'd want to see what your androgen levels are, so your testosterone and DHEA levels. So yes, it's not necessarily true, but we'd have to find out. We can test. Okay, did I cover everything? But what if my job is exercise? Man, that's a good question. It just means we have to get rid of all your other stressors, right? We've got to find those and get rid of them. Find the toxins, treat them, get them out of your, get those out of your cup so that the level can drop and you can more easily do your job, your physical job. Okay. Well, I think I'm going to leave it there. Those are some great questions. I didn't know. First, it didn't look like you had some questions, so that's great. I will not be doing a Wellness Wednesday next week. I am going to be on a vacation with my lovely wife for our 25th wedding anniversary. So I hope you'll excuse me and us while we are away. And we will meet the following week for sure and go through another important topic. All right, ladies, have a wonderful evening. Hope you enjoy the rest of your week and take care. Bye-bye.